That burning that starts in your lower back and shoots down through your buttock, your thigh, your calf, sometimes all the way to your foot. That electric searing pain that wakes you at 2 in the morning, that daily reality of planning every movement, every chair, every car seat, every set of stairs around what your sciatica will allow. You have tried the creams, you have tried the patches, you have tried the heating pads and the ice packs and the cooling gels, and every single one of them gave you the same result, maybe 30 minutes, maybe an hour of surface relief, before the pain came back exactly as it was, as if nothing had touched it. Because nothing had. And here is the thing nobody has ever explained to you about why every cream you have tried for sciatica has failed. It is not the ingredients, it is the physics. Your sciatic nerve does not sit at the surface of your skin. It runs 3 to 4 centimeters beneath the surface through layers of skin, subcutaneous fat, and deep muscle fascia before branching into the gluteal region and posterior thigh. Every cream you have ever applied for sciatica, every menthol gel, every lidocaine patch, every capsaicin product was designed to work on superficial nerve receptors in the upper dermis. It never reached your sciatic nerve, not because topical treatment cannot work for sciatica, but because the products you tried were never capable of penetrating to where your nerve actually is, which means the nerve that has been generating your pain every single day has never once been touched by anything you applied to your skin. I am going to tell you what reaches it, what penetrates all the way through those tissue layers to the nerve itself, and what it does when it gets there through 4 specific, documented, peer-reviewed mechanisms that no other topical product combines. But first, I need to tell you what this oil is not, because the moment I say essential oil, most people think lavender, tea tree, something from a wellness shop that smells nice and does nothing clinical. That is not what this is. This is an oil that the US military studied for battlefield wound healing, that NASA researchers analyzed for tissue repair in zero gravity, that professional sports teams across Europe keep in their training rooms but never discuss publicly, and that somehow, despite all of this, almost nobody with sciatica in America has ever tried, because nobody told you about it, until now. Stay with me. Because by the end of this video, you are going to understand your sciatica at a level that most people never reach, and you are going to have a topical protocol that finally reaches the nerve that has been out of reach this whole time. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on senior health. And what I am about to share with you tonight changes everything about topical sciatica management. Quick, before we go further, drop your age and city in the comments right now and tell me, how many topical products have you tried for your sciatica that never worked? Tell me in the comments. I read every single one. Subscribe and hit the bell. New senior health video every week. Now let us get into the science. Before I name the oil, I want you to understand exactly why your sciatic nerve has never been reached by anything you have applied topically, because this understanding is what will make every part of this protocol make complete sense. Your skin has 3 distinct layers: the epidermis on the surface, the dermis beneath it, and the hypodermis below that. Below the hypodermis lies the deep fascia, a tough connective tissue layer that separates the subcutaneous tissue from the underlying muscle. And it is below this fascia, within and between the deep gluteal muscles and along the posterior thigh, that the sciatic nerve runs its course from your lumbar spine to your foot. Standard topical analgesics, menthol, camphor, lidocaine, salicylates, penetrate to the dermis, some penetrate to the hypodermis, none penetrate through the fascia into the deep tissue layer where your sciatic nerve actually lives. They create sensations in the superficial nerve endings of the skin, cooling, warming, numbing, that temporarily compete with and distract from the deeper pain signal. The moment the superficial effect fades, the sciatic nerve signal returns unchanged because it was never addressed. This is the fundamental limitation of every cream you have ever tried for sciatica. The oil I am about to describe penetrates through all of these layers, through the epidermis, through the dermis, through the hypodermis, through the fascia, into the deep tissue where your sciatic nerve branches. And this extraordinary penetration depth is not a marketing claim. It is a documented property of its primary active compound. The oil is helichrysum, specifically Helichrysum italicum, an essential oil derived from a small flowering plant native to the Mediterranean and Balkan regions. And the reason it penetrates so dramatically deeper than any other topical compound you have tried comes down to one molecule: neryl acetate. Neryl acetate is the primary active compound in Helichrysum italicum oil, comprising between 20 and 45% of its composition depending on the source region. It is a naturally occurring ester with a molecular weight of 196.29 grams per mole and a specific lipophilicity, fat solubility, that gives it an extraordinary ability to pass through biological membranes. Research published in the Journal of Essential Oil Research measured the transdermal penetration rate of neryl acetate against a panel of other essential oil compounds. Neryl acetate penetrated human skin at rates significantly exceeding most other compounds tested, passing through the phospholipid bilayers of skin cells and continuing into deeper tissue layers with minimal resistance. The molecular structure that gives it this property is the same structure that allows it to pass through the fascia and reach the tissue layers where the sciatic nerve resides. And once it reaches that tissue, once neryl acetate is actually in contact with the inflamed nerve environment, what it does is genuinely remarkable. Here is curiosity loop number 1, and I want you to stay with me for this because it is the mechanism that separates Helichrysum from every other topical product ever marketed for nerve pain. Every anti-inflammatory product you have ever used, ibuprofen, naproxen, diclofenac gel, even capsaicin, works downstream in the inflammatory cascade. They reduce prostaglandins after they have been produced. They block COX enzymes after the cascade has already been triggered. They are trying to mop up a flood after it has already started. Neryl acetate does something completely different. It inhibits the enzyme that starts the flood. That enzyme is phospholipase A2, PLA2. PLA2 sits at the very beginning of the entire arachidonic acid inflammatory pathway. It is the enzyme that releases arachidonic acid from cell membrane phospholipids, starting the chain reaction that produces every prostaglandin, every leukotriene, every thromboxane that sensitizes your sciatic nerve and amplifies your pain. Without PLA2 activity, the cascade cannot begin. Prostaglandins cannot be produced. Leukotrienes cannot be produced. The entire inflammatory environment that is keeping your sciatic nerve hypersensitized is dependent on PLA2 as its starting point. Neryl acetate directly inhibits PLA2, not downstream, at the source. Research published in the journal Planta Medica found that Helichrysum extract significantly inhibited phospholipase A2 activity in inflammatory tissue models, with the inhibition directly corresponding to measurable reductions in prostaglandin and leukotriene production downstream. The researchers specifically noted that the PLA2 inhibition potency of Helichrysum was comparable to pharmaceutical PLA2 inhibitors, but achieved naturally and without the toxicity profile of synthetic options. For your sciatic nerve, which is being kept in a state of chronic hypersensitivity by the continuous production of prostaglandins and leukotrienes in the compressed nerve root tissue, upstream PLA2 inhibition at the tissue level is a fundamentally different intervention than anything a tube of menthol gel has ever offered you. But wait, here is curiosity loop number 2. PLA2 inhibition is not Helichrysum's only mechanism. The oil also contains a compound called arsenol, a unique fluoroglucanol found in no other plant on Earth. And arsenol does something that PLA2 inhibition alone cannot achieve. Arsenol simultaneously inhibits both COX-1 and 5-LOX enzymes, the two enzymes responsible for prostaglandin and leukotriene production respectively once the arachidonic acid has already been released. This means that even if some PLA2 activity escapes the neryl acetate inhibition, arsenol catches the downstream products and prevents them from completing the inflammatory cascade. Research published in the Journal of Natural Products confirmed arsenol's dual COX-1 and 5-LOX inhibitory activity, providing comprehensive coverage of both major inflammatory pathways simultaneously. No other single natural compound achieves this dual inhibition at the same time. Together, neryl acetate's PLA2 inhibition and arsenol's dual COX-LOX inhibition mean that Helichrysum oil attacks the inflammatory environment surrounding your sciatic nerve from 3 separate positions simultaneously before the cascade starts. At the prostaglandin level and at the leukotriene level, nothing that has ever been in a tube of pain cream has done this, And here is curiosity loop number 3, the fourth property of helichrysum that most people never hear about. The oil contains a class of compounds called decatones, specifically itolidiones, that have been shown in research to stimulate nerve growth factor, NGF, production in peripheral nerve tissue. NGF is the protein essential for the survival, maintenance, and regeneration of peripheral nerve fibers. In adults over 60 whose natural NGF production has declined with age, itoledione-mediated NGF stimulation directly supports the sciatic nerve's capacity for self-repair and regeneration, working at the biological root of the nerve deterioration rather than just reducing its symptomatic expression. One oil, 4 mechanisms, all reaching tissue that no surface cream has ever touched. Now I want to tell you about a patient of mine named Sharon. Sharon is 68 years old, retired nurse from Denver, Colorado, 2 years of right-sided sciatica that had defeated every topical treatment she tried. As a nurse, she had access to professional-grade pain creams that most people cannot even purchase over the counter, lidocaine patches, diclofenac gel, high-concentration menthol, prescription capsaicin. Every single one gave her temporary partial relief that faded within hours. She was spending more time applying creams than she was getting relief from them. Then her daughter, who worked in integrative medicine, brought her a small dark bottle of golden oil she had never heard of. She told Sharon to mix 5 drops with fractionated coconut oil and apply it along the sciatic nerve pathway every night before bed. Sharon looked at the bottle skeptically. She was a nurse. She trusted pharmaceuticals. She had spent her career administering them. The idea that an essential oil would do what diclofenac had not seemed unlikely to her, but she had tried everything else. She applied it the first night. The next morning something felt different, not dramatically, but real. A quality to the pain that had shifted. The burning was still present but less electric, less sharp at its edges. By night 5, the relief was lasting most of the day. By night 14, she was sleeping through the night without the burning in her leg waking her, something that had not happened in 14 months. She called her daughter. "What is in this oil?" Her daughter said, "Naryl acetate, arsenol, itolidiones." Sharon said, "And I have never heard of any of those." Her daughter said, "Most people have not." But the research on PLA2 inhibition and nerve tissue penetration is genuine. Sharon, who had spent her career in healthcare, went and read the studies herself. Then she called her daughter back and said, "Why did nobody tell me about this 2 years ago?" Today I am making sure you do not ask that question 2 years from now. Now let me give you the complete protocol, because application technique is as important as the oil itself. Purchase pure helichrysum essential oil, specifically Helichrysum italicum from Corsica or the Balkans, which has the highest naryl acetate and arsenol content. Quality third-party tested brands include Rocky Mountain Oils Helichrysum italicum, Plant Therapy Helichrysum italicum, and Florihana Helichrysum italicum. Expect to pay between $25 and $50 for a 5 milliliter bottle, which at the correct application dose provides approximately 30 days of nightly applications. Never apply helichrysum oil undiluted. Always dilute at 3 to 5% concentration, 5 to 8 drops per teaspoon of carrier oil. The best carrier for sciatic nerve penetration is fractionated coconut oil. Its medium-chain triglyceride composition has been shown in pharmaceutical transdermal research to significantly enhance the penetration depth of lipophilic therapeutic compounds compared to other carriers. The fractionated coconut oil is not just diluting the helichrysum, it is actively enhancing its penetration into the deep tissue layers where your sciatic nerve resides. Every evening, 30 minutes before bed, prepare your blend. 5 drops of Helichrysum italicum in 1 teaspoon of fractionated coconut oil. Apply along the entire sciatic nerve pathway on your affected side, beginning at the sacroiliac joint in the lower back, moving across the piriformis region of the buttock, down the posterior thigh to the back of the knee. Massage firmly using slow, deep circular movements for a full 2 minutes. The pressure serves 3 purposes. It increases local blood flow to enhance penetration, it mechanically drives the oil deeper through the tissue layers, and it directly stimulates the mechanoreceptors along the sciatic nerve pathway that activate the gate control pain reduction mechanism. Apply every night without exception for a minimum of 14 days. PLA2 inhibition from naryl acetate builds as tissue concentrations accumulate. Arsenol coex-Lax inhibition compounds progressively. Idilute NGF stimulation requires sustained exposure to produce meaningful nerve regeneration effects. Sharon noticed her first real shift on night 1. Most people report meaningful improvement between night 7 and 14. Every night of application is building on the last. One practical note for seniors applying to the lower back and posterior thigh, particularly if reaching the sciatic pathway on your affected side is physically difficult due to the pain itself. A long-handled massage tool can help ensure complete, even coverage of the treatment area with each application. The cream you have been using for your sciatica never reached your nerve. It has been providing surface relief while the nerve 3 centimeters beneath it continued generating the same signal unchanged night after night. Helichrysum reaches the nerve, narrow acetate penetrates to it, PLA2 inhibition silences the inflammatory source, arsenol blocks both downstream pathways. Idiluteones stimulate the nerve's own repair process. 4 mechanisms, 1 oil. The nerve that has been out of reach finally reached. Sharon's nights are quiet now, her mornings are different, and the oil that changed it has been available on Amazon the entire time her sciatica was getting worse. The science is in your hands now. Tonight, reach the nerve. Finally, drop your age and city in the comments right now. And tell me, have you ever heard of helichrysum oil before this video? What topical treatments have you tried for your sciatica that never gave you lasting relief? I read every single comment personally and I will reply to as many as I can. If this video showed you a topical option that actually reaches your sciatic nerve, share it with one person whose sciatica has never responded to any cream they have tried. You might give them back their nights. Subscribe. Hit the bell. New senior health video every single week. I am Dr. Michael Kent. 5 drops. Fractionated coconut oil along the nerve pathway every night, starting tonight. I will see you in the next one. The content in this video is created strictly for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment of any kind. Dr. Michael Kent is a fictional educational persona created for informational health content. This channel is not affiliated with any medical institution, pharmaceutical company, or essential oil brand. The information about helichrysum essential oil and sciatica presented in this video is based on publicly available peer-reviewed research. Individual responses vary significantly. Essential oils are not regulated as pharmaceutical products and quality varies significantly between brands. Always dilute helichrysum essential oil before skin application. Never apply undiluted. Perform a patch test on a small area of skin before full application and wait 24 hours to check for sensitivity reactions. Helichrysum oil may interact with blood-thinning medications including warfarin and antiplatelet drugs due to its anti-inflammatory compound activity. Consult your physician before use if you are on anticoagulant therapy. Do not stop any prescribed medication based on information in this video. If you experience skin irritation, rash, or worsening symptoms, discontinue use immediately and consult a healthcare provider. Always consult your doctor before starting any new topical treatment, especially if managing serious health conditions or taking prescription medications.